Thanks, Norm. A great opportunity to be here. Thank you, everybody. I'm practicing the stress management skills right now, Wendy. Thank you. Fantastic. I quite specifically wanted to go after Wendy because the piece about presenting on depression is it's a good fit around stress. So stress, when it is chronic and unrelenting, can lead to developing depression. Likewise, all of the skills, the strategies, the techniques that Wendy shared with us, those are all very transferable to the self-management and self-care around depression. So thank you very much for that. It's a really good fit, again, for what you can do to manage depression, particularly around when we're talking about recovery. So a really good place to start is just here, broad, and winnowing our way down. Depression is considered a mental illness. And when we're talking about mental illnesses, 1 in 5 Canadians will experience mental illness. So again, experiencing signs and symptoms that are severe enough to warrant a diagnosis sometime this year. That further distills down to about 1 in 3 Canadians experiencing a mental illness at some time in their lifetime. So furthermore, that looks like about 900,000 British Columbians dealing with or impacted by mental illness, and about 200,000 of those are children and youth. So these are not rare health issues. They're very common. Again, we tend to think of them as secondary to physical health, or less important, or perhaps different than, and there often can be a lot of moralizing and judgment around the experience of mental health disorders and mental illness, and that has everything to do with stigma, and I'll bring that back later. So in terms of what depression is, as I've mentioned, it is considered a mental illness, and it falls under a broader category of mood disorders. There's 2 main mood disorders. One is depressive disorders, so things like clinical or unipolar depression, that's what I'm talking about today, as well as seasonal affective disorder, postpartum depression. The other main type of mood disorder is bipolar disorder, formerly known as manic depression. And if we were here for much longer, I would delve into that, but we're not. So mood disorders, like depression, are characterized by disturbances in the way that a person feels, how they experience emotion, their day-to-day functioning is impacted, how they think, their behaviors, and their actions. So some facts about depression. It does become an illness, and this is very important to note, when signs and symptoms are severe, when they last several weeks. This helps us to tease it apart from low mood, from a bad day, because that happens and that's very typical. What tends to happen is that a diagnosis won't be made unless a person has experienced signs and symptoms for a minimum of 2 weeks. Again, that helps us to tease it apart from life's ups and downs. About 5% of the population will experience major depression every year, and it's one of the leading causes of disability worldwide. By the year 2020, the World Health Organization predicts that depression will actually be the leading cause of disability globally. So we cannot afford really to ignore this health issue. Taking a look at those signs and symptoms, and we use that language very interchangeably, but there actually is a difference between signs and symptoms. Signs are something that other people can see. You would notice a sign if somebody was struggling with depression. A symptom is something that is experienced internally, perhaps thinking that there's really no point in going on much longer, thinking that you are worthless or completely overwhelmed in life. And therefore it is really important to engage the people that we care about and ask them how they're doing. That gets you to the place of symptoms and can help reveal where somebody is really at and what kind of help and support they need at that point. And again, note that recurrent thoughts of death or suicide are very serious. And if you are in that situation, it's important to ask a person, are you thinking about suicide? Are you thinking about harming yourself? It is a myth that that will compel somebody to act on it. In fact, what it is a watershed moment where we can then help somebody to get help. And I'll share some resources at the end in terms of where you can learn more about how to support somebody, again, around depression and some suicide protocol. It's important to note that depression impacts people at work as well. And it looks a little bit different because people are often white knuckling it. They want to get through and they still want to do the best they can in the workplace, but it's a significant issue. And a lot of that's been actually mentioned already in terms of Wendy's presentation and the do more with less work environment. I could stand up here and tell you that there are certain populations that tend to be at higher risk for developing depression. Teens, adolescents, young adults. That tends to also be the age of onset overall for any given mental illness. Older Canadians are also a risk population. New Canadians can be a risk population for developing depression. However, when we know that actually over 70% of short-term and long-term claims in the workplace are related to mental health, primarily depression, anxiety, and substance abuse or misuse, you know that Canadians in their prime working years are also a risk population. So are you noting a trend here? There's no one specific population that's at risk. This is something, again, and it bears repeating, we all need to pay attention to. Depression knows no bounds. And just breaking it down a little further, we're going to see signs and symptoms in these different quadrants. People will be impacted in terms of their thinking, how they again experience emotion, their behaviors, and how they feel physically. You will see changes in all of those areas. However, it will look different from person to person. And the experience of depression, if somebody has recurrent episodes, some people may only have one, most people tend to have a few though, that can also change and look different throughout the lifespan as well. There are a lot of risk factors, and this list is not exhaustive. However, these tend to be the heavy hitters, and I just want to camp out a little bit on this slide, and I'll run through this as well. Distressing life event makes a lot of sense, right? Anything that can be extremely stressful for an individual. Financial stress it's really quite topical. We're seeing this more and more. Again, there's just an article I was reading the other day in the province that financial stress seems to be very much a cause in terms of people in their 30s to their 50s and higher rates of depression. Having a baby could put somebody at risk for developing depression. That might more specifically be postpartum depression. Medical conditions, strong correlation. And again, that makes a lot of sense because there are significant changes as well as wrestling with mortality that can come with our physical health. Side effects of medication or drugs could also be a triggering cause. Stress from another mental health problem. Oftentimes, depression and anxiety co-occur in conjunction. Oftentimes, people may use substances like drugs or alcohol to try and cope with the underlying depression that they're experiencing. Hormonal changes, again, lack of exposure to bright light in winter. I mentioned that earlier, seasonal affective disorder is what that's referencing. Talked about substance dependence. It's when you're dependent now on alcohol or drugs. Family history of depression could also be a factor. Previous episodes of depression, so the more episodes of depression you have, the more episodes of depression you will likely have. Difficult childhood, abuse and neglect, exposure to harassment, bullying, and discrimination, huge risk factors for depression. Ultimately, when people ask, well, how do people get depression? One of the best ways I've heard it explained is genetically, we are preloaded for a whole host of things to happen. It will be our social and physical environment that will activate those genes. So it's a little bit of both, right? It's nature and it's nurture. But pay attention to these risk factors. And if you know of somebody who's experiencing these, again, it may put them at risk for depression, and then consider those signs and symptoms and notice and engage. So it is really, really important to note, this is a medical condition and it is a common illness. Piece about it being a medical condition, again, is it really can help you to have that conversation with somebody. And it's a good end run around stigma and discrimination. When you frame it as what it is rightfully, a health issue, people are more likely then to follow up and get help. What it's not is a weakness or character defect. It's not about laziness. I mean, there were so many bullets that I could put up here in terms of stereotypes around depression that aren't helpful. What's important again to also note is that people may have some very negative internalized beliefs about mental health and about depression. Again, so it's really important to remember, you're not alone, health issue, treatment options absolutely available. There's hope. There's no amount of yoga by the sunset that's really going to help somebody who's experiencing clinical depression, right? So this is also the place, and as somebody who's also experienced depression myself, and I identify as a family member, when somebody is really in it, there's no amount of buck up or platitudes or be grateful for what you do have and what's going well that's really actually going to help. That can come later. All of that can come after somebody has received help. And I'll talk about what help looks like. But yeah, it's just important to withhold our judgments and maybe just withhold the platitudes and the cajoling until somebody has sought the appropriate professional help. So here's what we know. Effective help and treatments are available. Oftentimes what this looks like is counseling or therapy. Cognitive behavioral therapy, particularly, is known to work well for depression and anxiety. That type of therapy really looks at identifying unhelpful thinking and unhelpful behaviors and changing them. Changing thoughts to be more fair, balanced, and realistic. And around behaviors, looking at things like exercise, scale to where the person is at, assertiveness, and effective problem solving. And you can see how that would then impact or change the way that a person feels. Medication may also be very helpful for people. In particular, the new class of antidepressants, selective serotonin reuptake inhibitors, are typically prescribed. They are not habit-forming or addictive in any shape or form, and nor do they increase or raise levels of serotonin. What they do is they help serotonin, which is a mood-regulating neurotransmitter, work better in the brain so that somebody can have a restoration of what would be their typical or normal mood. Balance. The best outcomes tend to be when people use a combination of medication and counseling. But some people do well with one, and other people do well with the other. What's really important to note is that second bullet, the sooner somebody gets help, the better the outcome, the sooner the return to recovery, right? So it's important that depression is not left to just run its course. People tend to get worse before they get better. And I've hinted at this already. There can be some very serious and devastating consequences if depression is not addressed. And one of the most serious consequences I can think of is somebody dying by suicide. So it is really, again, critical that we pay attention and we engage. And by engage, I mean we have a conversation with the person that we care about or concerned about. In terms of our communication, again, it's really meeting a person where they're at, acknowledging their emotional state, expressing our care and concern for them. All good tips. The open-ended questions, I mean, basically that's the, can you tell me more about this? How are you doing? Questions that leave space for people to tell you where they're really at. It's important again to note that when you are communicating with somebody who is clinically depressed, it may be very difficult for them to communicate. Thoughts tend to be slowed, confused. The level of self-worth is so low at that point too. Self-esteem is tanked. So it can be very difficult for people to start to open up and tell you where they really are. So give them the space to do that. Something that you may want to sidestep or try to avoid using is the why. Why do you feel like this? Why is this going on for you? Why is often perceived as a bit of a judgment for the person who's in it. So again, I really recommend that how and can you tell me more, for example. cannot talk about mental health without addressing stigma, and this was on the top end of my presentation. It's important to note that stigma will prevent people from getting help. This is the thing that gets in the way, those internalized beliefs. What is stigma? I mean, essentially these are the judgments, the attitudes, and beliefs that are negative. And this is what really sets mental health apart from physical health, and it's deeply unfortunate when we look at those rates of prevalency. So in terms of help, one of the very first places I would recommend people follow up with is their family doctor. Family doctors in British Columbia have increased resources to support people who are experiencing depression, like more time within the visit. They may refer this person to a program called Bounce Back, where they can receive cognitive behavioral skills workbooks and coaching support at no cost. Doctors, again, can be able to screen for depression, and doctors also handle that continuity of care. Also, it is possible that what looks like a mental health problem is actually a physical health issue. And again, that's why a doctor can be a really good first step. Just tease out what exactly is going on for an individual. Doctors can then make further referrals as well. The Canadian Mental Health Association, where I'm situated, can certainly provide a lot of information around where to access services and supports, navigating what's available, as well as sharing and providing a lot more information about how to equip and get more knowledge for yourself. So do give us a shout. Interior Health Mental Health Center has drop-in hours as well for people. Really good fit for more complex mental health issues. That is a community resource as well. Crisis lines may be something that you want to consider equipping yourself with and knowing what's available, particularly for people who you know are really experiencing severe depression. Other resources that you may want to know about are Mental Health First Aid. It's a course available at the Canadian Mental Health Association. Teaches you signs and symptoms, what to look for as a first aider for the most prevalent mental health problems in Canadian society. Equips you again with a communication strategy to promote early intervention. And there is crisis first aid for suicidal behavior, so some training around suicide prevention that's within that course, so I highly recommend checking that out. We also have a course called Living Life to the Full that teaches cognitive behavioral skills in a group format. And Here to Help is a fantastic website that can give a lot more information about all types of mental health issues, as well as the Antidepressant Skills Workbook. That is another resource that you may want to check out. It is available on the Here to Help website. And Kelty Mental Health has a lot of information about child, youth, and family mental health. A couple other things, just as I'm closing here, is I want to make a note about protective factors. We talked about the risk factors. Protective factors are the things that can buffer, people from having the experience of depression. It's not a fail-safe, but it's a buffering component. And some of the biggest protective factors, and Wendy, you mentioned this as well too, and it bears bringing back, it's strong social connections. It's having the ability to take care of yourself in times of stress. It's having connection to your neighborhood, to your community. It's also about having cultural connections as well too. So those are just some really important things to consider in terms of where are you at with your social connections, cultural, family, traditions, where are you in your neighborhood and in your community, and what does that bucket look like in terms of your ability to take care of yourself and your self-care? Always worth examining.